again, everyone, and welcome. My name is Laura Cota Ortega, and I'm an advocate within our Advocacy and Community Engagement Unit at Disability Rights California. So really quickly, DRC has a grant to help people get the COVID-19 vaccines. So we want to make sure that you have reliable information that answers the questions you have about the vaccine and where to get one. So we want to know that you have the right to receive the COVID-19 vaccine, even if you're having trouble being vaccinated due to your disability. So these troubles could be not being able to get to the vaccine sites or not being able to leave your home to be vaccinated. So we're doing different we're partnering up with different organizations and clinics and giving $50 gift cards for people that are getting vaccinated. We're also trying to offer transportation or Ubers or rides if that's an issue. So I will put our number on the chat. If you're having trouble getting vaccinated for any reason, give us a call. You can ask to speak to Laura or Lena, and we'll be able to help you. We also have a survey that I'll put on the chat, which it's confidential, and it's just questions that will help us also get more information, more reliable information for you guys regarding the COVID-19 vaccine. So with that, I thank you, and I'll pass it to Lonnie again.
Thank you, Laura, and thank you again, everyone. So every summer, our agency looks to the community about the services that we offer. And during this time, our annual advocacy planning is in the process. And in order for us to ensure that clients' voices are being heard, we're asking you and your family members to help us do a better job. And what are some of the issues and concerns you may have that you would like disability rights to work on in the next couple of years? So I've placed another link for your convenience on the chat. We will also place that information onto the email that's being sent to Mina, who will then distribute all of the materials to you. If you could just take a few minutes of your time to help us understand what's happening and what are some of the concerns. We really want to hear from you. And if you could just fill out the survey for us, that will give us an idea on some of the work that we can work on in the next 3 years. So with that, thank you so much. I want to go ahead and turn it over to our presenter, Maria Urarty.
Hi, everyone. So today we are going to talk about Medi-Cal. It's I'm sure you've heard of the term Medicaid. That's the federal word. That's the word that the federal government uses, because this is some of our Medi-Cal programs are financed in part by the federal government, some are not. So every state gets to choose what they want to call their Medicaid program. So obviously, Medi-Cal is California's, and I think Arizona has some a very different name for their Medicaid program. So our training today will be specific to California. It won't be about any other state. So you're going to learn some basic information about Medi-Cal, some basic eligibility rules, programs in California for people with disabilities, Medi-Cal services, what happens when you have Medi-Cal and you have other health coverage, and applying for Medi-Cal. So we're going to talk about some terms and some players, because it's really important to understand these terms, because you'll see them when you're dealing with Medi-Cal. There are a lot of acronyms, so it's important to know what they are. The Centers for Medicare and Medicaid is the federal agency that administers both the Medicare and the Medicaid program nationwide. And the California Department of Healthcare Services is the state agency in California that administers the Medi-Cal program statewide. It can delegate its authority to other state agencies. So for example, IHSS is a Medi-Cal service. but the California Department of Social Services administers that program statewide. It has a memorandum of understanding with the Department of Healthcare Services to do this. When California agreed to participate in the Medicaid program, it submitted to CMS a state plan. And that state plan describes the nature and scope of the Medi-Cal program. What programs are we going to have? Who's covered? What are the services we're going to provide? Some services are mandatory. If we're going to take federal money, the federal government says you have to provide these certain services, but a lot of the services are optional. California doesn't have to provide them. If you are going to participate in the Medicaid program, the states have to follow federal rules and regulations and guidelines. That's part of the deal. If you ever want to see California state plan, there's a link there to see the state plan. So as I mentioned before, some of the Medi-Cal programs in California, lots of them are paid in part by the federal government. And when the federal government is helping to pay for the services under a particular Medi-Cal program, it's called federal financial participation. Now, there are Medi-Cal programs in California where only the federal government is not going to pay for the service. And those are called state-only Medi-Cal programs. And there are many, many, many programs in California that are Medi-Cal programs. So there's not just one Medi-Cal program. And each Medi-Cal program has its own eligibility criteria, which is really important to know, because when I'm talking to someone about their Medi-Cal, the first thing I want to know is, well, what program are you on? What Medi-Cal program are you on? Because that'll dictate my answer to you. Because I would have to look up the Medi-Cal program to see what the rules are, to see if what your issue is, your concern is a real concern or not, whether what they're doing is right or wrong, whether what the county's doing is right or wrong, because the county administers the Medi-Cal program locally. If you want to apply for Medi-Cal, you would contact your local county welfare office, also known as Department of Public Social Services in your county. I want to talk about Medi-Cal service delivery models. There are only two models in California. There's something called fee-for-service, and there's Medi-Cal managed care. Fee-for-service is you're in a Medi-Cal program you're in fee-for-service, and you get to go to any doctor that takes Medi-Cal. You're not part of a health plan. You just go wherever you can get a doctor to, see you, a Medi-Cal provider. The majority of people are not in fee-for-service in California. In fact, they're in Medi-Cal managed care. And even more people I think the tendency is for the state to go managed care. I don't know if they'll ever go completely, but since I've been doing this kind of work, more and more people are being forced into Medi-Cal managed care. Now, in certain counties, and they're here, Los Angeles, Orange County, Riverside, San Bernardino, San Diego, San Mateo, and Santa Clara, these counties are participating in what is called the Coordinated Care Initiative. And it's been around for, 5 to 7 years, if not more. And it did three things when this pilot program started way back when. It moved more people from fee-for-service into managed care. And for people who have both Medicare and Medi-Cal, it said to those people, you can have your Medi-Cal managed care plan take over your Medicare. So everything is under one roof. So your Medi-Cal managed care plan will handle your Medicare and your Medi-Cal. And if you agreed to that, because it was voluntary for those people, if you agreed to that, you would be placed in a program called Cal Medi Connect. The third thing that the CCI Care Initiative did in these counties, because we're only talking about these counties, is that in order for you to get certain services, you had to be in managed care. So they're called long-term support services. So nursing facility, IHSS, community-based adult services, the multi-senior services program. You had to be in managed care in order to get these services. Well, they changed it for IHSS in January 1st of 2018. They took IHSS out of this. So we were back to the way it used to be, where you just go to the county, they do the assessments, they handle everything for IHSS. So that happened with IHSS. And starting this year, they took the MSSP program out of that too. So you no longer have to be in managed care to get the multi-purpose senior services program. If you want to know more about the Coordinated Care Initiative, there's a link here. Cal AIM is, gosh, a plan to make many changes in Medi-Cal. A lot of stuff is in the works, but one of them is to make this model, this Coordinated Care Initiative model, a more statewide model. Let's see what happens. But for now, this is where we are with these counties. Okay. So when people call me and they're in this county, I want to know if they're in, if they're in Cal Medi Connect, obviously if they're in managed care, probably in managed care. So let me talk about managed care, and you can look at these links later. So there are different models of managed care in California. There's the geographic model, there's the, oh my gosh, 5 different models of managed care. Basically what it means is in some models, you only have one choice of a managed care organization. So Cal Optima in Orange County, that's the only managed care plan, the Medi-Cal managed care plan that you can choose. There's no choice, that's it. Other counties have the choice of 2 models, a private model and a public model. Other counties, like big counties like LA County, you have a number of choices of Medi-Cal managed care plans. So if you want to know what managed care model you're in, you can go into the first link, what they are. The second link will tell you, it'll have California, and you click on your county and it'll tell you the model for the county. And if you want to know about your model, the model you're in, you can look in the third directory. It's by county. You look at your county and it'll tell you what your current options are for Medi-Cal managed care to choose from. So Medi-Cal services. There's a term that you might have heard, full scope Medi-Cal versus restricted Medi-Cal. So full scope just means that you can ask for the range of services that are available through the Medi-Cal program. All the long-term care and support services, waivers, durable medical equipment, mental health, vision, transportation, hospital, etc. Restricted Medi-Cal is usually because of your immigration status. You only get Medi-Cal for, or your disability or what you're being treated for, you only get Medi-Cal for. So for example, if you're restricted Medi-Cal, you can get emergency services. So you're in an accident, you go to the hospital, Medi-Cal may pay for your emergency care, but you can't use the Medi-Cal to later go to your doctor and get a checkup, right? It stops when the emergency stops. Pregnancy-related care could be a restricted Medi-Cal. Long-term care also. Something happened on January 1st of 2020. The law changed, and the law currently says that anyone under the age of 26 can apply for Medi-Cal regardless of their immigration status. Medi-Cal doesn't care for people under 26 what your immigration status is. You can be undocumented, it doesn't matter. Of course, you have to meet all the other eligibility criteria for the Medi-Cal program that's being considered for you, income limits, resource limits, whatever it is. And starting May 1st of this year, anyone 50 or older can apply for Medi-Cal regardless of immigration status. It doesn't matter what your immigration status is anymore for anyone age 50 or older. But again, you also have to make sure you comply with the other criteria for the Medi-Cal program. So that this opens up, the possibility of a lot more people being able to qualify for Medi-Cal. List of services. First, I want to let you know about this guide. NHELP is an organization. They do nationwide work. They put together a guide on Medi-Cal services, and you have the link there to look at it. It's an excellent guide, but I'm going to stop sharing so that Lonnie or Mary can take us to the list of services in California, just so that you have an idea of how rich this program is. I mean, for me, I think Medi-Cal is the best insurance around, personally, better than any private insurance I've ever seen, because it covers things that other insurance wouldn't cover. So we have outpatient ambulatory services. You can read the list, but emergency services. Can you scroll down, please? Or scroll up, hospital services, maternity, newborn care, mental health services, prescription drugs, all kinds of therapies, PTOT, rehab, acupuncture, hearing aids, laboratory services, prevention and wellness services for chronic management, chronic disease management, pediatric services, dental, vision, all kinds of services, transportation services to take you to appointments, to take you in an emergency to a hospital, long-term services. Medi-Cal has, you can go, if you have Medi-Cal, you can go to a nursing home that takes Medi-Cal. You can also get nursing care at home through a waiver. I'll talk about waivers later. You can get home and community-based services, other kinds of, that's an umbrella for all kinds of other services. So I saw you're surprised that I say that Medi-Cal is the best. Your experience is that it's the low quality. I'm saying that the breadth of services is the best I've ever seen. So for example, if your private policy says, let's say that you need a power wheelchair and you've got private insurance and you've got Medi-Cal, and you've got Medicare and Medi-Cal. Let's say you've got all three of them. Well, Medi-Cal is always payer of last resort. So you have to start with your private insurance. And let's say that your policy says that they'll only cover up to $2,000 in durable medical equipment. Well, these power wheelchairs can be very expensive. Let's say that the one I want is $35,000 with all the extras that I need. So my private insurance is going to cover $2,000. Medicare is only going to cover durable medical equipment that I can use in the home. Medicare doesn't care that you need it to access the community. So if Medicare decides that I don't need a power chair to access my home, it will deny any payment for that wheelchair. So now we go to Medi-Cal. Medi-Cal will pay for a power wheelchair so that you can access the community. So you're going to get most of it covered through Medi-Cal. You would get very little of it covered through private insurance, probably none through Medicare. That's what I mean. Just the breadth of services that are available. I know I've been doing this work for more than 20 years, and we never get calls from people who are having success stories with Medi-Cal, so I get what you're coming. I understand that maybe the quality of the service is not that good, but you need to be, if you're not happy with the quality of the service, you should be filing, complaints with your If you're in managed care, you should be filing complaints with your managed care plan. You should be reaching out to the Department of Managed Healthcare and complaining about the quality of service. With that, if you don't complain, nothing will change. If you are in managed care, we have a really good publication on filing grievances and filing, and appealing. And includes your ability for most Medi-Cal managed care plans to file complaints with the Department of Managed Healthcare. The Department of not the Department of Healthcare Services, the Department of Managed Healthcare. It has jurisdiction over many of the Medi-Cal managed care plans. We've had really good success stories from clients who have had problems with their managed care plan, who have complained to the Department of Managed Healthcare and have had their issues resolved. Also through the Department of Managed Healthcare, if their plan denied something because your plan said that it wasn't medically necessary, through the Department of Managed Healthcare, you can request an independent medical review. So your case is reviewed by a doctor in the area that the services that you're requesting is in. And if that doctor decides that it is medically necessary, the plan has to give it to you. And the last stats I saw on successes of people filing in independent medical reviews was that over 60% of the requests are granted. This is just a list of services. Thank you, Lonnie. So I'm going to go ahead and go back to the presentation. When we talk about Medi-Cal services, we also have to talk about medical necessity. Every plan has requirements for you to get the service. And in Medi-Cal and in other, and so does Medicare, so do private insurers, they all have their definitions of what they consider to be what is the definition of medical necessity. So Medi-Cal's definition for adults 18 or over is 21 and over, is that what you're asking for from Medi-Cal. And it doesn't matter whether you're fee-for-service or managed care, the rules are the same. What you're asking for has to be reasonable and necessary to protect your life, to prevent significant illness or significant disability, or to alleviate severe pain. Now, who does the determination? It's the provider that is asking, on your behalf for whatever it is you're asking for. They're the ones who are having to tell Medi-Cal why what you're asking for is medically necessary. They're going to know what the definition is, and they're going to have to talk about this. For children under the age of 21, the definition is much broader. It's anything to correct, ameliorate a defect, physical or mental illness or condition. You might hear, I don't know if you've seen the acronym EPSDT, early periodic screening, diagnosis and treatment. Children and young adults under 21 in the Medi-Cal program have what I always call extra benefits. First of all, the medical necessity standard for them is much more, it's much broader. And if the state plan, if adults, for example, if Medi-Cal says that for adults, you can only get two, I'm making this up just to give you the example. Let's say that Medi-Cal says that adults can only get 4 sessions of physical therapy a month. Well, if a child needs 6 sessions of physical therapy a week, and it's medically necessary because they're under 21, and if it's medically necessary, they will get that. So there's a really good publication that written about these services and the rights that children have to get services and to get what they need. Really important documents. You're going to want to see that. I'm going to stop right now to see if there are any questions so far, because the next section I'm going to talk about some basic eligibility rules, but there again, and we're going to go through, I'm going to show you where the programs are that we deal with for people with disabilities. And you'll see the different criteria for each program. We're going to learn a little bit more about eligibility in the next section. So I'm going to stop right now to see if there are any questions.
There are some questions in the chat, Maria.
Mhm.
And the first question is, surprised you are saying Medi-Cal.
Yeah, I answered that one
Okay.
already.
1 second. Lonnie, can you pause? Sorry. I don't know if you paused.
Oh, stop the recording.
Yes.
Yeah, I didn't. So we're going to talk about Medi-Cal eligibility basics. There are over 90 eligibility categories. So there's not just one Medi-Cal program. I guess if one takeaway from this presentation is that you should think of Medi-Cal as this umbrella, and under this umbrella, there's so many Medi-Cal programs. Some of the programs we work with have income requirements, resource requirements, immigration status requirements, although we've seen the changes in law recently about that. Obviously, you have to be a California resident. So every Medi-Cal program has an aid code. So you may not know, your notice of action when you got on Medi-Cal will usually tell you what Medi-Cal program they put you on, and you really don't pay attention. You're just so happy to get Medi-Cal. But if you were to call me about your Medi-Cal, the first thing I would say is, well, what Medi-Cal program are you on? And you may say, well, I don't know. And I said, well, you need to call your Medi-Cal eligibility worker and ask what Medi-Cal program you're on, or ask what the aid code is, the Medi-Cal aid code. So we're going to go to this. I'm going to stop sharing and we're going to go to this link so you can see the aid codes for California. This was updated this year. We have, so all of these, there are different aid codes. If you want to just scroll down, I think there are, I don't know how many pages of aid codes, like 90 pages of aid codes. So, if you say to me, I have could you stop just right there? My aid code is D3. I'll look up the aid code and I'll know that it's restricted to pregnancy related postpartum. So this is a restricted Medi-Cal. It has a share of cost. It means that you have to spend money in health benefits, vision or dental, before your Medi-Cal will kick in. And who is eligible for this type of Medi-Cal program? These are people with, on persons residing under color of law. These are people whose immigration status doesn't allow them to get full scope Medi-Cal. So, anyway, the aid codes are there for you to look at. If you ever want to know what Medi-Cal aid code you're in, look at the notice of action. If not, call your eligibility worker and get the aid code, because with the aid code, you could look it up here and then and you can always look up that. You can always look at that program and see what the criteria is for eligibility and everything else. So for a lot of programs in Medi-Cal, they look at income. You have to have a certain amount of there's a ceiling to the income, countable income that you can have. Some Medi-Cal programs like the Working Disabled program allows you to have Medi-Cal while you're working, so long as your countable income is below 250% of the federal poverty level. And there are other Medi-Cal programs, many other Medi-Cal programs that have different limits on countable income. But when we're looking at income, they're looking at earned income, unearned income, like let's say that you're on another Social Security program, such as Social Security disability insurance, unemployment, pensions, annuities, money that people give you. That's all unearned income. in-kind income. If you live with other people and the other people are paying your house, completely paying your housing or completely paying your food, the program is saying, well, you're getting help for food and or shelter from people in your home. This is usually for adults, and there's a dollar value to that. And we're going to include that as part of your unearned income, in-kind income calculation. Sometimes income is unavailable and it won't count towards Medi-Cal eligibility. Now, there's an example there. And there's exempt income, public assistance, other foster care payments, etc. You could do a whole day training on income. It's just, there's just so much, this program is so complex and there's so much information. I'm just trying to give you a brief overview so that as far as income is concerned, they're looking at countable income. Every Medi-Cal program will allow you to make deductions to your gross income to get to countable income. And you compare your countable income with the income level for that particular Medi-Cal program. When we talk about income, they consider income in the month it's received. And if that income continues to be available, it becomes a resource the following month. There are exceptions when we talk about lump sum payments. Let's say you get an inheritance, you win the lottery, you get a retroactive SSI or IHSS check. We have two publications. The first one is Medi-Cal lump sum payments. How much time do you have to spend down the money that you get before it becomes a resource? And you've got that information there. For people who, it's different for people who are on SSI. Their Medi-Cal is linked to the SSI and there are different rules. It's the SSI rules that you follow. So if you have Medi-Cal, if you have SSI, you have the Medi-Cal linked to the SSI, you would be looking at the second publication, not the first one. Countable income is what matters. There's generally, in some programs, you just have to look at what the program is. You generally a $20 deduction from unearned income. If you have earned income, there's a $65 from gross income, $65. And if you didn't use that $20 in the unearned income because you didn't have any unearned income, you can deduct it there. Then you divide by half to get to countable income. And if you have blind work expenses or impairment related work expenses that are approved, this is money you're paying out of pocket to work, to be able to work, and they're approved by Social Security, by Social Security or Medi-Cal. You can deduct those from your gross income. But like I said, every program has its own rules of what it's going to allow you to deduct to get to gross income. I'm just giving you an idea of generally some of these programs are very similar in the things that they require for income and resources. There are Medi-Cal programs where you have to have limited resources. If you're a single person applying, you can't have more than $2,000 in countable resources. If you're a married couple, you can't have more than $3,000 in countable resources. And there are things that don't count, and they're on this list, and there are many more things that don't count as countable resources. There's a Medi-Cal program called the Magi Medi-Cal program that also is available to people with disabilities. That program doesn't care about your resources, not at all. They don't care. And by the way, for Medi-Cal progress starting, when is it? July 1st of this year, the resource, and I'm going to give you a link that tells you this information for non-Magi Medi-Cal programs, because the Magi Medi-Cal program doesn't care about resources, but for non-Magi Medi-Cal programs, the resource limit is going to go from 2,000 to 130,000. And by 2024, the Medi-Cal program is going to do away with with looking at resources. That's a really big change. but be careful. If you're getting SSI and you're getting the Medi-Cal linked to the SSI, SSI hasn't changed its rules. It still requires that you have no more than $2,000 in countable resources for a single person or $3,000 for a married couple. So be careful. Although Medi-Cal is by 2024 is not going to care what your resources are, SSI still cares what your resources are. And as far as resources are concerned, you have to report. If you obtain a resource or get rid of a resource, you need to be, that would be counted. You need, actually probably anything I would recommend and see where it goes, but you need to report the receipt of the resource or disposal of the resource within 10 days. CalAble. We did a training on CalAble to your group. Remember that you can put up to $16,000 in an ABLE account and it will not count as a resource for Medi-Cal, SSI. SSI, you can have up to $100,000 in your ABLE account and it won't count against, it won't count as a resource. And there's more information on the CalAble program. We talked about that already. In Medi-Cal, just like in SSI, there's a concept called deeming. So if a child is applying for Medi-Cal, the income and the resources of the parent with whom the child is living will be deemed to the child as if the resources and the income of the parent were the child's. And that could disqualify the child for Medi-Cal. There's spouse to spouse deeming too, and sponsor deeming. Anyone who sponsors you to become a lawful permanent resident, it's possible that Medi-Cal will look to the income and the resources of your sponsor to determine your Medi-Cal eligibility. This is called deeming, and they deem income and resources, but there's a big exception, and it's called institutional deeming. And so what does that mean? If you qualify for a waiver in California and the waiver has language in it that says that Medi-Cal will apply the institutional deeming rules to see if this person qualifies for Medi-Cal, then what the Medi-Cal eligibility worker will do is pretend that the child or the spouse is living in an institution, because if a person is living in an institution, you're not deeming the resources and the income of the person with whom the person lives, right? So you pretend that the person's living in an institution and therefore you don't deem the resources and the income of the parent or the spouse. But in order to do this, you've got to be on a waiver. So in California, we have a number of waivers. There's a link here to the Department of Healthcare Services webpage about all the Medi-Cal waivers in California. So there's the home and community-based alternatives waiver. If you qualify for this waiver, you will get, so let me step back and explain what a waiver is. A waiver is just extra services for a subpopulation in California. Remember when we started this conversation, I said that California, when it took money from the federal government to establish its Medi-Cal program, promised that it would follow federal rules. Well, the federal government requires states to make Medi-Cal available statewide. That's called statewideness. California can't say only San Diego counties, it will have the ability, only the people living in San Diego County will have the ability to apply for Medi-Cal. Federal rules prevent that. Statewideness. And it says also that California has to offer the same benefits to everyone statewide. You know, full scope benefits, everyone has the ability to ask for all the benefits under the state plan. That's called comparability. So when California wants to do something different, it could amend the state plan, ask CMS to approve an amendment of the state plan, or it could ask for a waiver. What is it asking to waive? to waive federal rules, to waive the federal rule of statewide-ness, to waive the federal rule of comparability. So now with these waivers, California can offer more services to a subpopulation. So for example, the home and community-based waiver is for people who, if they were not living in the home, would qualify to enter a nursing facility level A, level B, intermediate care facility, continuous nursing, which is the highest level of care under the intermediate care facility for the developmentally disabled, CN, continuous nursing, subacute or acute level of care. If you meet the criteria for any to get in, if absent living in the home, you would be able to get into any of these levels of care, then you would qualify for the waiver, and you would get, you would be able to get, for example, one of the services under the waiver is nursing care at home. If I didn't qualify for a waiver and I needed nursing care at home, I couldn't get it. My options would be in-home supported services, a patchwork of stuff to keep me at home. Maybe going to a sea bass center during the day, or whatever, or go into a nursing home. But with a waiver, I can have nursing care at home. So you see how, and these waivers are 300 and some odd pages. It describes, every waiver is a document, and the document describes the services under the waiver, who qualifies for the waiver, who the providers could be, guarantees that the state has to give the federal government. It's just, these are, and these have been approved by CMS. So this waiver, in the waiver itself, the document has this concept of institutional deeming. And it says that Medi-Cal, if this person qualifies for the waiver, you're going to apply the institutional deeming rules to see if this person qualifies for Medi-Cal. So if it's a minor, then the Medi-Cal eligibility worker is not going to look at the income and resources of the parent with whom the child lives, right? The same with the DD waiver. If you're a regional center client and you qualify for the DD waiver, it also has the institutional deeming rules. That's how kids who couldn't qualify for Medi-Cal, just because, when not on a waiver, couldn't qualify for Medi-Cal, can qualify for Medi-Cal because they're now they qualify for a waiver, because the waiver tells Medi-Cal that this is what you're going to do to make a person eligible for Medi-Cal, because waivers are actually services, extra services to a subpopulation of people. For the DD waiver, the subpopulation are regional center clients who qualify for the DD waiver. There's criteria to qualify for the DD waiver. For the multi-senior services program waiver, it's people, 65 or older or 55 or older, and there's criteria to meet the waiver. This also has institutional deeming. The AIDS waiver, the self-determination program is a waiver. It's a home and community-based waiver, services waiver, the assisted living waiver. So there's more information there. So let's see if I have this in his, okay. So for the lady who I'd been talking about, so most, it used to be that in-home operations is a division within the Department of Healthcare Services. If you wanted to apply for the waiver, you had to contact in-home operations. They'd send you an application, they'd send a nurse to do an evaluation, and then, you're on the waiver or you're not on the waiver. And you would be dealing with in-home operations for things related to the waiver, right? So it changed some time ago. And in most counties in California, there are waiver agencies that are responsible for the waiver services. So the lady who said her son is on a home and community-based alternatives waiver, what you would do, let's see if I have the ability, is look up, go to the Department of Healthcare Services. I don't know if I've got the ability to do a Google search from here. Maybe here, let's see. I was looking at Ticket to Work. Okay, so I'm going to Google DHCS waivers. I go there. See, here are all the waivers. In-home operations, there are only a few counties where in-home operations continues to be responsible for the waivers. Otherwise, you're going to waiver agencies. And let's see if I can find the waiver agencies. Multi-senior. Hold on. Maybe what I need to do is, this is what I'm going to do. Oh, come on. Waiver agencies, DHCS. Let's see. How come I'm not finding it? Let's see. What's the, Mary, do you remember the whole name of these waiver agencies? There's a whole,
I don't remember the name, Maria. I thought I seen it right now when you did the search. I think if you put DHCS waiver agencies, DHCS in the beginning.
If I may interrupt, I think Loni, I think it's just called home HCBS waivers. HCBS waiver, and then
HCBS waiver agencies, that's what it is.
Yes.
HCBS
Waiver agencies.
waiver agencies, California. Who's responsible for administering? Well, that's the DD waiver. Help me out here.
Wow.
California waiver fact sheet. That's for DD. Okay, well, we're gonna,
I'll do a search.
Mary and Lonnie will continue to search, and we'll show you, because so once we have the information on the waiver agencies in California, you look up your county, and that's who you should be dealing with for the waiver, services, approvals, etc. So we'll get that information for you. Aside from a lot of these programs having income limits and resource limits, and we know what's happening with resources in California in the near future, you also have to have a qualified immigrant status. But no, there's been the recent, for anyone below 26 or over 50, it doesn't matter what your immigration status is, but if you're in between those ages, then it will matter. You have to be a qualified alien. There are many statuses. Persons residing under color of law includes people who are paroled by immigration court for less than a year, granted stay of deportation, granted indefinite voluntary departure, et cetera, et cetera, et cetera, and even people who the government knows are here, but the government has no intention of deporting. So there are many, many people who do qualify for Medi-Cal because they are either PRU-call or they have that qualified immigration status, or they're below 26 or over 50. And you have to be a California resident also. I want us to now look at some of the programs for people with disabilities. I talked about the modified adjusted gross income Medi-Cal program. This came about when Obamacare came around. We created a new Medi-Cal program in California, and it's for people whose income, different kinds of people whose income are below 109 of the federal poverty level, 138 of the federal poverty level. I've got the federal poverty level chart here for 2022, so you could look up that information. So what the Magi Medi-Cal program does is it looks at the adjusted gross, modified adjusted gross income in your tax return. It looks at who's in the household, and then it makes the determination. The Magi Medi-Cal program doesn't care about resources. You can't be on Magi if you have Medicare. And I'm going to show you where you can find out more information on all of these programs. Other programs that we deal with for people with disabilities are the Ssi Linked Medi-Cal, or if you were getting SSI and you worked and you lose your SSI because you're now making too much money, you can continue your Medi-Cal under 1619B, Pickle and DAC and Disabled Adult Child Medi-Cal. This usually happens post eligibility for Medi-Cal. There's a change in your Social Security, and so that affects your Medi-Cal. The Aged and Disabled Federal Poverty Level Program, the Working Disabled Program, the Medically Needy Program in California is a program where you might have a share of costs. What does that mean? It means that before every month you have to spend your share of costs. Let's say that Medi-Cal says, Maria, based on your accountable income, you have a share of cost of $1,000 every month. I have to spend $1,000 in medical care, dental care, vision care, any combination thereof, before Medi-Cal kicks in that month. And if I don't meet my share of cost that month, I don't have Medi-Cal for that month. You know, there are ways to get people out of the Medi-Cal, the medically needy program. You know, and if you're in a share of cost program, you should contact us.
Maria?
Yes.
Sorry, before you get started, I think I found it.
Okay,
could I share really quick?
Yeah. Okay, so here, thank you, Lonnie. Yes, I want to see what okay, so it's home and community-based alternatives waiver. Okay, great. These are the waiver agencies, and we're going to put the link on chat, and we're also going to give Mina all of everything that we've shown you so that you guys have the actual links. But so the lady that I was speaking to about her son being in the HCBA waiver, what county are you in?
Yeah, we are in Orange County.
So you're in Orange County. So let's look at Orange County. If you see Orange County, we thought last time, could you scroll down a little more to see if we can all the way? So wait. I think I saw Orange up yeah, a little further.
It's the Bertana.
And sections of Los Angeles and Orange counties. So the first thing you would want to do, it's define service area defined by zip code. So let's go ahead and click that. No, right above that one.
No, it was the Bertana Home Health.
Right there. So if your zip code is here in under Orange County, then that would be the waiver agent. Can you scroll up so we can, yeah. Is your zip code here?
Yes.
Okay, so let's go back to the prior. So you are with your waiver agency is Libertana Home Health. You need to be contacting them to get the show on the road.
Yeah, I tried talking to them, but they said they don't deal with nursing services if the child is below 21 years of age. So if you want skilled nursing services, it goes either through CCS or EPSDT.
Then you need to be talking to in-home operations.
Oh, okay.
In-home operations is a division within the Department of Healthcare Services.
Okay.
Okay.
Okay, and I'll check on that then.
Yeah, and let me know if you have problems, just give us a call. Mary has her information on chat, and so you can just get a hold of her. So
Okay,
I'm going to
thank-
take you, yeah, you're welcome. I'm going to take you to a website called db101.org, where you're going to be able to get a lot of information on each program I mentioned in the prior slide about disabled adult child Medi-Cal, Pickle Medi-Cal, 1619B Medi-Cal, the 250%, the Magi program. And these are just, this is just the programs we work with for persons with disabilities. But like I said, you may be a person with a disability and not be on, and have Medi-Cal and not be on these programs because maybe you're on another program, which is like the family plan, right? The family Medi-Cal plan. So, but we, you know, these are the programs that a lot of our clients are on. And I'm not going to go through DAC, Pickle, or 1619B. You can do that. But I will take you to db101.org. Aside from teaching you about the different Medi-Cal programs on this website, if you ever want to, if you're a person with a disability and you want to go to work and you want to see how your public benefits would be affected by your earnings, they have a toolkit on this website where you input your information, and then you get information on the work rules for the different Social Security programs. So the income-based Medi-Cal, this is the Magi Medi-Cal program. You can't be on Medicare. And can you just start scrolling down? So, and this is for people 19 to 64, and depending on what group you're in will depend what your federal poverty level is. Can you scroll down? And so this tells you information on each program, Medi-Cal for people with disabilities. Can you just scroll? Yeah. So here are the different Medi-Cal programs for people with disabilities, the aged and disabled federal poverty level program. It tells you what you can do, and it'll start to tell you this is for people who are 65 or older or disabled. What are the asset your resource requirements? You can't have more than 2,000. Remember, in July it changes. Now it's 130,000, right? And what you're able to and your countable income, it can't be more. If you're an individual, it can't be more than 1,563 this year. What your deductions are to this program. And so if you want to scroll down, just scroll down so people can see. And so every program has its rules. Every program will tell you what to deduct from gross income, what resource limits are for the program. And so there's a lot of information here. So you've got, thank you, Lonnie. I think that's, yeah. You've got the gosh, I lost the, hold on a minute. You've got the link, and there's something even better. And this is like the manual I go to. I gave you in resources a publication authored by Western Center Law and Poverty on Medi-Cal eligibility. It's got 2016 numbers, so all the federal poverty levels are 2016. So it's a little outdated as far as numbers, but you've got the federal poverty level chart for 2022, and all you would do is just, look at whatever you're looking at as far as Medi-Cal program, you just use the 2022 numbers and not the 2016 numbers that are in this manual. It's an excellent manual. It's as far as information on each program, far beyond what DB 101 does. So, and it talks, I mean, if you ever wanted anything and everything about Medi-Cal, you're going to want to go to this manual. So really important manual. Let's see what else we've got. Hold on, I just need to make sure I know where I am. So you've got the DB 101. Disabled adult child benefits. Sometimes you lose your SSI because now you're entitled to disabled adult child benefits through Social Security. If you lose your SSI, you lose your Medi-Cal linked to SSI, but it's possible for you to continue your Medi-Cal under what's called DAC Medi-Cal or another Medi-Cal program. The county has to reevaluate you to see what other Medi-Cal program you qualify for. Pickle Medi-Cal is for people who were getting SSI and SSDI, and they lose their SSI because of a cost of living increase in their SSDI. There, you lose your SSI, you lose your Medi-Cal linked to SSI. So one way to continue with your Medi-Cal would be under Pickle Medi-Cal, or maybe another program through Medi-Cal. 1619B is for people who work and lost their SSI because now they're making too much money to qualify for SSI. You can continue with your Medi-Cal that way, or maybe continue with your Medi-Cal under the 250% working disabled program. That's a very different program. That's a program where, depending on your countable income, you pay a monthly premium for your Medi-Cal. You get to put money into retirement without that counting as a resource. But as we've seen, the resource limits in California are going to change in the near future. I want to talk about other health coverage. So I talked about the power wheelchair example earlier. So Medi-Cal will always be payer of last resort and will only pay for expenses that it covers, and that other coverage will not. And I gave the example of private insurance, Medicare, CCS, and Medi-Cal. California Children's Services is a state program funded by the state for people who qualify, for anyone below the age of 21 who qualify for services. The disability has to be physical in nature. It's not for developmental disabilities, or not solely developmental and not solely mental. There has to be, and there's a list of disabilities that qualify to get you CCS. There's other criteria. Anyway, so this is the way it would work. Private insurance goes first, Medicare, then if CCS is going to, if it's a service or something that you need for your CCS eligible condition, then CCS would cover it. If it's not, then Medi-Cal would, because CCS will only cover the services and things you need for the CCS eligible condition. I had a case where the mother came to me and she said her daughter was in CCS and had Medi-Cal, and CCS. She was a person with cerebral palsy and other disabilities, and the mother had asked for a bunch of durable medical equipment from CCS, and CCS denied it all. And I asked the mama, what was your daughter's eligibility, what disability qualified her for CCS? She didn't know. So I called the nurse case manager for CCS and I asked, and she said, well, her heart condition. And I said, I called mom, and then I understood why CCS had denied all that durable medical equipment, because it had nothing to do with the condition that made her eligible for CCS. At that point, I said, you need to be getting this from Medi-Cal, not CCS. And she eventually did. She didn't understand how CCS worked. So we're going to go to some changes that have happened and will be happening in 2022. So I'm going to go ahead and stop sharing so that Lonnie can bring up the first document. So certain people with share of cost Medi-Cal are going to transition, if they were in managed care, are going to transition into fee for service. Can you scroll up so we can see the whole thing? That started in January of 1st in the 7 CCI counties, right? And 22 coast counties. That's a Medicare model. They're usually up in Northern California. And you can read more about that. Next thing. Mandatory managed care enrollment just for certain populations of people, which started in January 1st of 2021 statewide. Transition, remember CCI, if you were part of the coordinated care initiative, was to that you had to be in managed care to get the MSSP Multi-Senior Services Program. Well, in January 1st of this year, they said, no, you don't have to be in managed care to get that. It's okay, you don't have to be. Enhanced case management and community support services starting January 1st. Medi-Cal plans can begin to offer enhanced care management and community support services. And it talks about for whom. This is for families, for individuals and families experience homelessness, high utilizer adults and adults with serious mental illness or substance abuse disorder. It'll expand the group of people who could be eligible for this. Read this. If you think that this is something that applies to you, you should be contacting your managed care plan and asking for this. Medi-Cal prescription drugs, your managed care plan is prescription drugs are carved out of managed care. It's now a fee for service. You shouldn't have seen any changes in how you get your drugs. It's all behind the scenes, and so that started January 1st. Expansion of Medi-Cal for people. This next section for adults 50 and over. Elimination of the Medi-Cal asset test. It talks about what I just said, starting July 1st, and then in 2024, complete elimination of the resource limits for the non-Magi Medi-Cal programs. Cal Medi Connect, remember, if you have Medicare and Medicaid and you're in a CCI county and you elected to have your Medi-Cal managed care plan take over your Medicare, it was called Cal Medi Connect. Everyone in Cal Medi Connect are going to transition into what's now going to be called dual special needs plans. And there's more information there and resources for you to look at. So thank you. We're not going to go to the second one because it's the same information about the elimination of resources, just with more explanation, and you guys can look at that at your leisure. Applying for Medi-Cal, there's information here. There's something also called Benefits Cal that started in September of 2021. And Lonnie, I'm going to stop sharing so we can go there. I don't know if you guys know this. Give me a moment. No, that's not the one. It's the one for Benefits Cal. That's just more in-depth. It's right there, Lonnie, right above. I can see it. Yeah, there we go. Whoops, you got it. You were there. There we go. A new way to apply for and keep your public benefits. So as of September 27, 2021, Benefits Cal helps people with CalFresh, Medi-Cal, County Mental Services Program, CalWorks, General Assistance, Cash, the CAPI program. You can sign up online for Benefits Cal. You can apply and renew for benefits, appoint an authorized representative, upload documents, report changes, contact your caseworker, and more. So for the lady who said that she was having a lot of difficulty, that the paperwork is really complex, you might want to sign up for Benefits Cal to see how different it would be for you to do an application online. Yeah, we're going to post it. You're going to get the presentation with all of the links. And whatever links we put on chat that are not in the presentation, you're also going to get. Thank you, Lonnie. And we are going to now go to, we've looked at some of these resources, but I also wanted to point out Health Consumer Alliance. They're a nonprofit, and they also help people with their benefits, with benefits issues. So do reach out to them should you have any questions about your benefits. They have publications online also. So we've come to the end of the presentation, and we can take questions.